Their age, I don't know what they call the local age that those children. Or we must have a child. We could be billions and billions. They are not all ages created. We are created to their children. They will just be educated. You teach us on that one for us and we sit together, then we discuss it. You will not get a problem with us. Be aware that for us to have good communication, they just take us home sometimes. Friday they come to you, Saturday, we do not passport refund and no eggs like those.
I think we are telling back what we will do.
My name is Bobo, participant. When you are a Christian, be a Christian 100%. But what we want to do is, if you are asking out, therefore you should not die or believe Christianity because you are not. Therefore, you need the public planning and the economy use because you are not that.
But I think we included in the agenda. So we're going to make the ADHO made in our presentation that are coming on board in the subsequent. We'll be able, because I sit. Where do you want us to be? I don't know whether it is the uptake of the services or access from 80, but where do you want us to be? Where do you want this to be? From the presentation, I thought I should make that comment. Mobilize the stakeholders. This tendency in us, the public servants,
so that I will not sit here away the money. We are those our Rwenzori, we say and we work together, we are not blaming anybody. We are using our pillars, and it is an appeal that whenever you are operating, please if you have any maternity, whatever, all one of our people can talk to them, because you will be thinking, you will be very busy to talk at all what you are supposed to do. But if you can work together, Dr. Rwenzori was saying that we need to be happy, friendly. But I think they can also be very sanity. So we did a workshop. People have had that today. And we should not also forget the media. These media people are very important to us. I will not talk about that a bit. But as of our Rwenzori will come in, that please whenever there is that we have chance in the radio. Every week we have light record and Messiah. And I think we are going to play that one. People can be giving that what we talk about. And we can be looking to what. And I know when the Muslim says this, that's we command the very big. And the reason was the judges can come together with the judges. We talk about people. And the family planning, I think they want control. I think that is the word control. I think we should take that as acknowledgement. Yes, basic.
have received
the message.
the message.
Because the very moment they say control, say, hey, then that's why our people will say, but produce. But you can say, you see, our king has also made pronouncements. I think our had also some teaching from government, you know, the Minister of Trade, whatever. So they don't want to start power. Because whenever we do this issue, we are aware. They want to start to power. And those who have a is promoting health without anything. And to confirm that one, we have also had this type of book called of Rwenzori, Maternal Health, and again the violence. Even in the violence, that's why we have this one. I want that system where they said a young mother also can be a young one. Thank you for inviting us, and thank you, Mama. Thank you very much. That's why you feel the light in this story. Because what I would have written here was not the one I was going to talk. Have I not given the information as a minister?
Thank you very much.
Thank you very much.
Thank you very much. From account, I want to address you for approximately 3 minutes. I know you all were able to say you wanted to go, but I want to ask you, just as our brother said, Mr. Alice, that we must engage in the resource mobilization. So I want to give a task for one who was development partner, actually to say something so that we will also give you time to brief this people and then if we can accept this up. But to make it for you.
Thank you so much, moderator, for giving the opportunity. My name is Francis Ulo. I work with Population Services International, PSI. I just wanted to also make my submissions around family planning because that is majorly what we are supporting within the district. At the moment, we are supporting about 83 facilities within the district, and Kasese is our highest scoring district in terms of the number of facilities we are supporting. So, the issue about the drop in family planning uptake, I can summarize in 4 ways, and I'll be giving also some of the action points or suggestions for improvement. One, it is the health workers' capacity, one of the collectors. We have trained providers in all these facilities, and what we expect at the facility, it is about passing on the knowledge. We are seeing integration is coming up, which is now the good directions because family planning is not supposed to be only offered at MCA or the FP unit. So, in the event that a trained provider is not available, any other health worker or midwife should be able to offer a better planning. So, what you will see as a way of improving this is conducting CMPs, so that the trained providers is able to pass on the knowledge to a new provider who has been attached to the unit, who has been recruited. We have a model. We are looking at the capacity of the network. We have complete plans for universities identified through the support of the ADHO to go and provide you with inside level mentorships. So I will also request the DHT with the leadership of ADHO to see that these mentors, they are able to support facilities where they have a least staff capacity. The second aspect is around documentations, and I think that one is directly leading to low numbers reported, and in the presentation has also been highlighted. So documentation can still be around capacity. We have seen in some other facilities someone who is newly attached to FP is not able to document clearly. So can we strengthen even capacity building around documentations? We have seen in other hospitals where you find a student nurse is given the register but are not documents. So I would also encourage the interns here. Can we see that when we receive these student nurses, when we new providers, they're able to be trained on proper documentation. The doctor also come with tools, not relevant tools. At the moment, we have prices on 2019 version of 2024, and we are able to support the family planning registers. So in any case, we are seeing challenges with the registers. For the interns, then we'll be able to link up with the biostats. And we see that these registers are very low facility. From the side of PS side, we are able to offer or support with this family planning register fully. The other aspect, the third one is reporting, and this one can also directly lead to the job. We have seen also in most cases, we miss out the data on family planning because when you go to health 3, 4, and hospitals, yeah, we rely on the providers, and we see the HIAs are not really supported in terms of saying that they get achievement on family planning. And if this one is not also addressed, we see that annual report is going to lead us to the drop in the numbers. And then the last is commodity. Sister will agree with me, when we are looking at the uptake parameters, we realize that some other methods have been having shortages of commodities. And that one is mainly national outcry. And as a district, when we are doing our ordering, only forecasting, we need to do accurate forecasting and see that when commodities are supplied, they are able to support the need. And also with PSI, we can support with that. Transfers of commodities, and the payment is fully supported on this. So even though your facility is having challenges with commodity, but there are other facilities with surplus, and we are expecting that coordination so that we see that the inter-facility distribution is fully supported. I think those are the few things that I needed to contribute, and thank you for it.
Thank you, Mr. President. I think, as I said, families has some other programs. And some of your concerns will be answered when the government has done its work and has grown. You are ready to ask some of your concerns. So, I'm not aware of the right to come. I have the phone to each one of those here.
Thank you. Our technology has grown. Let us continue to be done better. This is how we get up and then address the congregation to find the rest of the issues which are discussed as. But we are not.
Thank you very much. BHO. It came for all the members of our different health units. RDC is supposed to be here. See you already? We are grateful that he is here. We have the food department and the 9 colleagues. The development partners, all of you, the advisors. When it comes for reviews, you think of different issues. Have we performed? We already have the goals to
have worker plans to handle. And that's why you come to review. If you did not plan, you cannot review. But because we had the targets and we have implemented, that's when we can organize this meeting to review. To what extent have we performed? Where are the gaps? What can we do to bridge the gaps? That is the purpose of this meeting. Where we have performed well, we benchmark. Those who have not performed to that level can benchmark, and the next time we perform as expected. We have done some work, but we always say there is a room for improvement. We are not saying we are poor performers, but whatever we do, we don't get 100%. Therefore, we like you here to review so that next time we are seeing improvement. Everyone is concerned about the indicators, how they attended to it. It is known here that people work because of the presence of their supervisors. Where there are no supervisors, people tend to relax. That's why we encourage initiatives to be in charge. How initiatives who are not in charge. And by definition of your one time, you need to see you are in charge. You need to be in charge. In charge of what? The whole environment, the buildings, the staff, the performance, and the resources where you are. Are you in charge or you are in charge? I told my DHO to identify for me at least 10 so that we relieve them of that duty being in charge. If they are not performing to the expected performance, and we give it time, you are in charge for 1 or 2 years. But no, if you handle that assignment sometime where you feel you cannot handle, you are the Now, when you look at the appraisal forms, the same person will say, this is excellent performance. Then you say, what is the truth? So, as we gather here, my gifts sometimes shy away from appraising the people who are paid more salaries than theirs. But you have been handling the same. I've been getting the card of my DA position until I'm the white smoke. And the cows became the highest paid civil servants in the district. We do not believe, so when it came, we just took it away from the change. They use meetings. But I've been in charge of the DHO, the engineer, the natural resources, and all of them. We even promote you. There was a clinic officer who came to my office for promotion to senior. And they asked me, now when you become senior, how much will you get? It was always and get that salary, not to disturb you. You can console yourself and can after all, I have a few waiting back. Let them get their money. That's what we are saying. But please take charges and then the rest of the staff. Take your appraisal forms, go so that you can see that they are also in charge of you. Now, it's very difficult for a cow to know that the inside is not there. It's very difficult. That's why the structure goes up. The last person. When you really find a chief telling you we have a problem in our health unit because of the, I don't know why. And we need to be doing our duties, all of us, so that we know who are performing and who are. We have good ones and we have bad ones. And populated back from to say away about the higher office because when they use that they also had the reform of it. How that one reduced from the hours of work they give to the service. Producing for those that are already paid. This kind of did you see that question? Who was the new man? There are more people saying that it's very rare to find someone who has ever produced that area. It is now a dualist country. Then the one gets right, then they to as a compliance unit for all the reports they have produced to our office. But if you know the reports you have to tell you that all of you will one time.
Members, I need to bring to your notice the presence of these important dignitaries. The count has just moved out. We have our district planner, also our ministers. We have town clerks and some other groups, just like I was married to them. We have a facilities. We have OBR, representatives of Rwenzori. We have the chairperson of the Religious Council, Ghana, represented here. We have and so far those are the important. How do I call it? That is quite
about the issues. There's also a concern that some in charges of PhDs. We are calling to and is not satisfied. Also, in our presentation, we found that there are issues. If you find that there is a knowledge gap, the mic to my colleague so that he begins from there. Thank you so much.
Thank you so much, sister. The comments and the questions here I have and response. We shall not run away from it. It's a means of health, a tool that is guiding us. Clinics better, we are able to make appropriate preparedness for our mothers, and so we are able to categorize them and know where is supposed to deliver from. What do we start with? We are saying that at the level of Center 4 and the commission husbands, because there are many risk factors that can let a mother go into PPH, some of whom there. We need to embrace that. The other aspect is those people who are not aware about MPDSR. Why we are not in that Center 3 is because we have not covered all the Center 4s in the MPDSR and high-risk clinics. Apparently, NM has been supporting us in terms of moving to facilities. But we move to a facility, which is even at high-level hospital status, and the staff have never heard about MPDSR completely. And no wonder in our presentation we realized they have never reported anything like a bad outcome. But in the registers there were many. So we missed that. Now that comes to a question of how about the documentation, why the improper documentation. If you can't realize the importance of data, you, the one who's generating it, you will not take a bother of collecting the actual information. The game changer is understand why you need that data. As a person, as a facilitator, as an individual, of what use are you writing my name and my age? Of what use are you writing my parental ability? If you understand that as a primary source for connect of information, you will complete that register. If you don't understand that from the start, you will not. This requires leadership support. We have had leaders, we have had in charges who don't even mind about checking, supervising their own people. They don't want to check in the registers. All the thing is, we have submitted the report of 105 to the district, but have you checked what has been collected? Have you checked what has come on board? And now that's one of the game changers we did at America. The leadership, but also involvement of everyone to know that data is very important and it's the source of income for the facility and it's the source to put you ahead that you're performing very well. And we involve everyone to come on board. So that to embrace this data. We even went ahead to say every department must collect its data and summarize it. And when the data person is coming, they enter together that data to be sure that this data you're entering is the correct data you provide to the staff. What will happen to a records officer coming to register which is incomplete and you're not there? What will she report or what will he report? They will start booking in the data and thinking that we have 10 and then you end to have 30. So that is what we are fighting and that's what we are looking at. So commitment, leadership, teamwork, and involvement of stakeholders where you need support. I mean, most of the times we have been on headlock, we have been chasing and they will support us seriously. When there is something we need, we ask them to just write to prove why you need it. So there's no way you look for something you don't know the reason why you need it. So you will remain behind and never be supported. Apparently, they will be supporting people for attachment in the hospital in the D2 department. How do they pick you when you're not showing interest, when you're giving us data, when you're not showing us your problem? So let us embrace this and be able to do what is expected of us. In Yamira, we realize the importance of data. So every time the midwife is writing that form, is filling the data, we are able to trace and know because we have known the handwritings of midwives and other people. So we can tell this is the one who delivered. Even you write your name, you're the one who delivered. So you have not completed. We call and say, what is the problem? There will be some problem you're not having. So when we do all this, I think we are able to do all what is expected. Kirangirat, we have not failed to do support function in a quarter. At least we have tried. Now, yes, we are supporting, but what is the quality of the support function are we giving to our law facilities? Which support do we give them? There are times I go for supervision and I end up in the theater, and I think Eric knows. Time we are supporting Chekegwa, we reach down, we find mothers and men, doctors, and we get a theater, and the support function ends there in the theater.